And so now it is my distinct pleasure to welcome the President of the Pharmaceutical Society of Kenya, Dr. Louis Machogu, to give his remarks, and thereafter welcome the Cabinet Secretary. Over to you, Mr. President.
Thank you, Dr. Daniela. Just correct me a little bit. So the CS has time today, Mommy? Sorry, I missed that.
Yes, the Cabinet Secretary is on the way to the office, and she will have time to give her address.
Okay.
Yes, so she will make her address after you. If you could unmute your video as well. Over to you.
There you go. Distinguished guests, CS Trade Director, State Department of Trade, all dignitaries and esteemed colleagues, honorable fellows, good morning. It is indeed my great honor to be with you this morning on this inaugural event. Of course, to my colleagues, I'd just like to pass my heartfelt regards, having contracted COVID last week rather, and I'm actually doing well, as you can see, and thank you for your all warm wishes. So for mine is just to read out the note from the President, and I'll read. I wish to extend to you a warm welcome to the PSK Pharma Supply Chain Conference, that is themed Supply Chain Planned for Expanded Access to Quality Healthcare. Amongst the processes in supply chain management, planning and risk management are key to, I've just lost my notes there. A key to mitigating deadlines, meeting deadlines, assuring quality and mitigating against loss. This requires accurate demand planning that entails quantification and forecasting to ensure the supply chain cycles are aligned with product consumption rates and any possible acceleration and deceleration of demand. We all know, like, for example, the vaccine that has been brought into the country only has a shelf life of 4 months. So this is where supply chain comes in, and you're able to focus and plan and see what will it be able to meet the demand, even with the perceived sort of resistance or lack of understanding on what the vaccine, who should take, rather acceptance of the vaccine. So all this needs to be put in, and that's where supply chain expertise comes in, and why this supply chain conference is really apt at this point. Supply chain planning has taken center stage to perhaps more than ever before with COVID-19 pandemic. We've seen decline in access to raw materials, pharmaceutical manufacturing raw materials, and even finished pharmaceutical products. There are several factors that contribute to the efficiency and effectiveness of any supply chain. Firstly, we need data analysis in order to give us correct information to make informed decisions. However, we cannot analyze data unless it's available and visible to us. This is critical because without data, we are unable to just even know how much of the vaccine is being consumed at the current status. And I would like to laud the Ministry of Health and the vaccine department for just the good work they're doing there. Secondly, we cannot have a functional supply chain without acquiring the right talents and trained human resources that are necessary to return the huge investment made in the pharma supply chain. Especially with, pharma supply chain is very expensive to put in place, so you have to have the requisite human capacity. And I know teams like KQ Cargo have invested heavily in pharma supply chain, so it's really important that we have teams that are able to ensure that you get a return on your investment. Thirdly, supply chain security is the ultimate goal. Of quality assurance in the supply chain. You do not want to have your medicines out there and you cannot guarantee that this is actually what was brought into the country. Fourthly, we have we have to develop and enforce proper regulations to ensure that supply chain actors comply to the laid down rules and regulations, good distribution practices. And this is where the Pharmacy and Poisons Board comes in with the regular updates and provide us of domesticated rules and guidelines around pharma supply chain. As a professional society that exists to promote the ethical practice of pharmacy, we are cognizant that good practice depends not only on law enforcement, but also on perhaps more importantly on self-regulation. As PSK, we are governed by a code of ethics, a code of conduct that ensures that we uphold the highest possible professional standards. And this is how we get our social contract from the public, by adhering to these self-regulation guidelines, where we put ourselves to task to ensure that these are life-saving entities that we are to ensure that they are actually guarded well. Finally, you cannot speak all this even if you're a nation without talking about the money. Finally, we have the finance. We have to finance the resources required in the supply chain. Pharmaceutical products are ethical products, and whose supply should not be interrupted unnecessarily, and this may lead to detrimental effects to the health seekers. So that's why we have to have our banks, innovators around financing to ensure that trade flows of raw materials, and mostly even as we talk with the Ministry of Trade and Industrialization, even try to see how this can all be done even locally, and we can also be a supply hub for the region. And this conference gives us an opportunity to all of us as actors at the various levels along the pharmaceutical value chain to discuss pertinent considerations for ensuring quality, efficacious, safe, cost-effective, and timely medicines for achieving the health care needs.